How is pain-free dentistry different from regular dentistry? Are there different types of sedation, and how can I choose the right one?
All right, so pain-free dentistry works in different ways. So if you are particularly referring to the sedation, I'll come to that in just a moment. But pain-free dentistry can work in three different ways. One, anesthesia-free, meaning anytime you are going to get some kind of a dental work done, we gotta, most of the time we gotta give you anesthesia. So anesthesia, like even from the slightest injection, you may be thinking it may be pain, because a lot of the reason, many times patients are dreaded just about the injection they are going to receive in the mouth, and particularly one in where?
The upper?
Yeah, the roof of the mouth, right there. Right here. So
They all hurt though.
yeah, they all hurt, but this one patients complain the most, which is the roof of the mouth right here. This is the roof of the mouth on the inside, right there. It hurts the most, and patients don't like it at all. So if you're dreaded about the injection, and sometime what we do is to avoid the injection, we can do laser dentistry. For example, laser dentistry, sometimes you don't have to give any numbing at all, and you can actually cut the tooth, and you can do that without the anesthesia. So if you're referring to no anesthesia dentistry, it may be called a pain-free dentistry. If you're referring to the laser dentistry, and that may be considered sometime as a pain-free dentistry also. Going back to the third one that you mentioned, which is the sedation. So what that means is, before you receive the injection, you are going to be put to sleep, which is what we do in our office, right? All the time. So we put patients to sleep, and putting patients to sleep can work in multiple ways. So one, we call it as an oral sedation. You take a pill, then you go to sleep, or we put the patients to with IV sedation. Giving you oral sedation means like absolutely no injections whatsoever at all, and you go to sleep, or you lose some kind of a memory, and then once you go to sleep, then we give you the injection, which you're not going to ever remember. That will become a pain-free dentistry. And then speaking of the IV sedation, you still have just one needle, just like this. If you have good vein like me, then it's going to be very, very easy. And if you don't have a good vein, and sometimes you may if you are not being told by the provider or the dental office, drink a lot of water. I always tell my patient, a lot of drinking and peeing, right? A lot of drinking and peeing. Get gallons of water to keep drinking until 2 hours prior. The clear water is okay. You cannot eat or drink for about 8 hours prior to the procedure anytime you're doing oral or IV sedation, but you can drink clear water up to 2 hours. But anyway, so once you have come to our office and then we put you to sleep, then it totally becomes pain-free. So speaking of the pain-free, multiple options: no anesthesia, no local anesthesia, no injection, laser dentistry, or putting you to sleep via oral sedation or IV sedation.